My name is Jack Benson, and the topic that I chose for this presentation is amyotrophic lateral sclerosis. What is amyotrophic lateral sclerosis? This disease, better known as ALS or Lou Gehrig's disease, which is named from a famous baseball player, is a progressive neurodegenerative disease that affects nerve cells in the brain and spinal cord. There are two main types of ALS, the most common being sporadic. This form of ALS is the most common in the US, making up over 90% of its cases. This form is believed without any cause or family history. Familial is the second one. This is the form of ALS that is believed to be inherited and only affects a very minimal amount of people. The history of ALS. ALS was identified in 1869 by a French neurologist named Jean-Martin Charicot. The disease became more widely known in 1941 when a famous baseball player who played for the New York Yankees passed away. His name, Lou Gehrig, is often what the disease is referred to. The most common discovered genes are SOD1, which was found in 1993, and C9ORF72, which was found in 2011. Risk factors of ALS. ALS is typically fatal within 2 to 5 years of its onset. Most people with hereditary ALS give their children a 50% chance on inheriting that gene. The average onset of ALS is generally between the ages 40 to 60 for both sporadic and familial. Men are at a higher risk of ALS than women with a ratio of about 1.2 to 1.5, but as ages increase, the risk between men and women are pretty much the same. And 3 to 5% of people suffering with ALS will also be diagnosed with frontotemporal dementia. Statistics by age. I found this statistic online, and this is from the years 2019 to 2022. And as you could see, from ages of about 40 to 80s when they are the highest count of people who are diagnosed with ALS. And this is when like often when people are diagnosed. Normal versus ALS motor neurons. So the top one is a normal motor neuron, and the bottom is somebody with ALS. As we could see, especially with the myelin sheath, there is a lot of damage, and signals aren't firing the way that they should to the muscles. Um, there is also tremendous damage, as you could see. It's not all well put together as it is for the normal motor neuron. How is ALS diagnosed? So there is no specific test to diagnose ALS. However, there are certain tests a healthcare provider can perform on a patient. The first being an MRI. An MRI produces detailed images of the brain and spinal cord. A blood and urine test, which shows the neurofilament light levels. An EMG, which tests the electrical activity within muscles, and the nerve conduction study, which measures the nerve's ability to send impulses to the muscles. Most of the time, people that are being diagnosed with ALS have to get tested with multiple um, tests to see if that's what they really should be diagnosed with. There's usually not really one test, and that's why I listed a bunch. What are the symptoms of ALS? So here I put a picture up that shows some of the systems or some of the symptoms that you may have in different parts of the body, but I'll list a few. So as ALS progresses, more and more symptoms start to become noticeable. Symptoms include loss of impairment or motor control in both arms and legs, twitching and cramping of muscles, especially in the hands and feet, difficulty swallowing, breathing issues, and slurred speech. Stages of ALS. So for my presentation, I picked 4 stages, which is going to be early, middle, late, and the end stage of ALS. Early stage of ALS, symptoms are mild and usually only affect one region of the body. In 2/3 of patients, the disease starts in the limbs, where fine motor tasks, balancing issues start to arise. 1/3 of people diagnosed have the disease arise from bulbar muscles, which are the muscles of the mouth and throat. This leads to slurred speech and trouble swallowing and chewing. Early stage typically lasts a year. Medical care for early stage includes medications that will help relieve symptoms, therapies, and planning to make accommodations for later stages. The middle stage of ALS. Muscle weakness becomes more severe and more regions of the body are affected. Muscles become weakened and sometimes even paralyzed. Loss of muscle mass intensifies. Risk of choking is greater, along with the struggling to breathe of both muscles in the mouth, throat, and chest weaken. Some people also experience the Noah Bulbar effect, which is uncontrollable laughing or crying. Patients will likely need assistance in day-to-day activities in this stage. They will be able to move some body parts under their own efforts. However, mobility becomes restricted, and patients lose the ability to drive, sometimes need aids, walkers, or wheelchairs to get around. This stage lasts anywhere from a few months to more than a year. Late stage of ALS. Muscles and voluntary movement become paralyzed, and they have little to no ability to move under their own power. Eating and drinking through a tube, difficulty or no ability to talk, increased risk of pneumonia as chest muscles become severely weakened, and low oxygen levels, which cause fatigue and brain fog. Most patients will need ventilatory support as breathing function declines. The late stage lasts within 2 to 3 years of the onset of symptoms. End stage of ALS, unfortunately, there's no cure. ALS is fatal, and majority of people die within 2 to 5 years of the onset of symptoms. Common causes of death due to ALS are respiratory failure, malnutrition, problems with heart rhythms, and pneumonia. The reason for this is because of the weakness of, chest muscles and throat muscles. It's really hard to eat and breathe. In the end stage, medications are given to relieve pain and ease anxiety. Hospice care is also available to help patients physically, emotionally, and spiritually needs before death. Patients usually don't need hospital or emergency care, but they can if they need it. Impact of exercising with ALS. Exercise is an important component of the management of ALS since the disease causes progressive weakness. Exercise prescription varies between individual, and vigorous exercise is to be avoided. Exercise won't rebuild muscle or rebuild affected muscles. However, it can offer other benefits like stress reduction, maintaining strength, staying mobile and flexible, improving sleep, and maximizing respiratory and cardiac function. Types of exercise. So, for strengthening exercise and resistance, you want to use light bands, body weight, dumbbells, um, working out in a pool, anything that's going to keep them from doing anything too heavy. They shouldn't be doing really anything that's loading the spine or compound movements. Um, any aching or other signs of discomfort should be avoided at all costs. For aerobic conditioning, I suggest walking, hiking, or cycling. These are very easy on the joints and it's to something compared to like running or anything like that. Stretching. So stretching keeps the joints mobile and pain-free, and also a care provider can help them do that as well. Um, Stretching is important because a lot of patients with ALS become sedentary and are always sitting on the couch or just not moving like they should be. Case study. Mike is a 64-year-old male who has been diagnosed with ALS 3 months ago, as well as high blood pressure. He has been struggling with weakness in his legs and balance, which has led to his diagnosis. The doctor has reported that he is in the early stage of ALS. Mike is 6'4", 250 pounds. His BMI is 30.43, which classifies him as moderately obese. He's not a regular exerciser, so it is important that he sees a physician prior to starting exercise. Being in the early stages of ALS, he is a low-risk client. However, this disease may progress quickly. The goal is to maintain enough strength to improve his risk of falling and delay the progression of the symptoms. Exercise testing. So for muscular endurance, a 30-second chair raise would be beneficial because it is a safe and effective way to test a person's ability to do functional everyday movement. Flexibility, sit and reach test. This is also a safe option to test upper body flexibility and is important for ALS patients since many become sedentary and lose range of motion in their joints. For muscular strength, the hand grip dynamometer is a safe and easy way to predict overall muscular strength levels. We don't want these patients benching, squatting, whatever. This is something easy that they could just squeeze in their hand and keep them away from injury. Aerobic 6-minute walk test. This walk test is a low intensity indicator of cardiovascular fitness. So for exercise prescription, for aerobic, I would say 3 to 5 days a week at a very low intensity. They shouldn't even be going really close to 50% in my opinion, but I put 30 to 50%. Um, the time should be 30 to 60 minutes, and the type should be swimming, walking, and cycling. For resistance, I have 1 to 2 days max per week. Um, it could be very hard for someone with ALS to even do any resistance training in the first place. So I think it's smart to keep the days down, and the RPE should be very low. If you're using resistance bands and stuff, you could go very high in repetitions and with low weight as well. The type should be resistance bands, body weight, or machines. Flexibility, I recommend 5 days a week. You could even go more than that. Stretch until you feel tightness, hold for 30 to 60 seconds, and they should be static stretching. Modifications and concerns. It is very important that when dealing with a client with ALS that they don't overwork their muscles. It is much easier to overtrain patients with ALS since their muscles are already weakening. It will be beneficial to shorten sessions or the intensity based on how the client is feeling and the stage that they are in. As the disease progresses to later stages, exercise will eventually need to stop. Medications like Razule and edaravone can help delay the loss of VO2 max, stress during exercise, and small benefits and limb function. Conclusions. What I hope everybody takes away from this is even though ALS is incurable, there's ways that we can make it easier for patients with ALS to um, I guess not have their symptoms come on as fast or just make them feel better in the process of this terrible disease. The backstory of why I picked this topic. So I'm gonna move myself over a little bit. Um, so this is my grandpa. He actually suffered from ALS, and this is a big reason why I wanted to pick this topic. My mom, who raised me and all my siblings, we really me especially me and my brother were twins. We kind of got to see the process of this happening. But as you could see, my grandpa right here is when he first got diagnosed with ALS. He was about 240, 250 pounds, and these pictures here, these are about a year and a half, 2 years later. You could see he's a lot skinnier and the disease is really getting to him. He dealt with a lot of symptoms, including choking was a huge one. He really couldn't eat that much. Um, and it was very difficult for him to get down food. Towards the later stages, he started to become like delusional and couldn't really like have clear thoughts and stuff like that. He also had very bad balancing issues, and that's how he actually ended up being diagnosed. He fell down and couldn't get himself up, and he couldn't realize why. And they ran a bunch of tests on him and stuff, and figured out this is what he had. The last two slides are just my references, and thank you guys.